Good afternoon, everyone. I'm Zach Schamberg. I'm the President and CEO of the Pennsylvania Healthcare Association, or PHCA. And behind me are the dedicated individuals, the men and women of our nursing homes, personal care homes, and assisted living communities who make me very proud to be a part of this very special event. Let's give them a round of applause behind me. But it is out there, beyond the walls of our capital, where the people that we care for every day reside. It's our vulnerable senior citizens. It's our adults with disabilities. It's our loved ones, like my grandparents. It's our neighbors, and it's our friends. Earlier today, the men and women behind me walked the halls of this Capitol building. They met with their elected officials, and they demanded support for what they do and who they care for. And that support is needed now more than ever. I am here to tell you, though it is certainly no secret, that Pennsylvania is a rapidly aging state. Our fastest growing demographic is age 80 and older. The baby boomers are aging into the demographic most in need of long-term care. And in just 5 years, the number of Pennsylvanians age 65 and older will equal and then eclipse the number of Pennsylvanians aged 19 and younger. So what we are advocating for today, whether it's investments in Medicaid, rewarding quality outcomes, workforce solutions, policy initiatives, it will not just benefit the vast majority of Pennsylvanians today. It will ensure a brighter future for Pennsylvania tomorrow. It will support our seniors. It will create career ladders and opportunities for younger Pennsylvanians. And it will stabilize a part of the long-term care continuum that desperately needs our help. But here's what is benefiting no one right now: the state of long-term care in Pennsylvania today. This is my 10th PHCA rally day. And it's hard to believe that this is my 10th time either standing on those steps or standing at this podium calling for support. But this is unlike any rally day that we have ever held in our history. And that's because as we stand here in Harrisburg, the long-term care continuum across Pennsylvania is on the verge of collapse. In just the last 3 weeks, 2 nursing facilities in Pittsburgh have announced that they will close their doors forever. One is a for-profit facility, and the other is a nonprofit, faith-based home. Because workforce challenges and insufficient Medicaid funding don't discriminate based on how you file your taxes. Separately, providers have just declared bankruptcy in Pennsylvania. This will affect 12 nursing homes across the state, not to mention hundreds of caregivers, the residents they care for, and their family members. And nearly 2 weeks ago, late on a Friday night, a nursing home in Scranton, Pennsylvania had to be evacuated, leaving residents and their families scrambling just to find care options. More than 20 nursing homes across the state have closed since the start of the pandemic. And we have 40 fewer personal care homes and assisted living communities than we did just 2 years ago. It does not have to be this way. Given our aging demographics, it cannot be this way. And I would like to stand here and tell you that things are going to get better, that we're going to be able to turn this around. But unless we do something in this year's state budget, unless we support long-term care, what I have just described is only the beginning. It is not hyperbole to say that we can't wait one more year, one more month, one more week. We need support today, and I hope that everyone will agree with that. That's why we're calling on Republicans and Democrats, members of the House and Senate, to come together, to put partisanship and party lines aside, to do one thing: support our seniors and to support the men and women behind me. Now at PHCA, we pride ourselves on not just talking about an issue, but coming to the table with solutions. And that's what we did today. The men and women behind me came to the table with solutions and they made their voices heard. And now I want to call on a few folks who also know how to make their voices heard. I want to start with State Senator Judy Ward, a registered nurse, a small business owner, the chairwoman of the Senate Aging and Youth Committee. There has been no louder voice for long-term care than State Senator Judy Ward. Senator.
Thank you, Zach. Good afternoon to everyone, and thank you for inviting me here today to rally in support of long-term care in Pennsylvania. As chair of the Senate Youth Committee, I've been fortunate to work with Minority Chair Senator Maria Collette on advocating for policy that supports long-term care in Pennsylvania. There are currently many efforts to promote independent living and community health care services across the Commonwealth, but there is still a very vulnerable portion of the population which is deemed nursing facility clinically eligible and dependent upon the availability of enhanced care. Nursing home providers are appropriately positioned to care for those individuals who can no longer reside safely at home or have required dedicated care management services to do so safely. And I've had family members in that situation. The funding increases advocated by PHCA would have significant impacts on care for our seniors. Specifically, the funding would be used to hire additional staff who could serve more residents, thus easing the burden on acute care partners and the community. In addition, the funding would enable facilities to increase wages of providers currently on staff, which is a critical factor in retention and also increasing starting wages for new staff. We also need to reward facilities that excel in the care of their residents, and that is where PHCA's Enhancing Care with Incentivized Payments, or ECWIP, comes in. By funding this program, facilities that demonstrate high-quality outcomes based on metrics using timely data would be eligible to receive additional funding to support that enhanced care. As advocates, legislators, and citizens, we need to work together to ensure that the long-term care industry in Pennsylvania is not only stable, but capable of growth. Long-term care facilities are shutting down beds, wings, and even their doors in the face of expanding financial and staffing burdens. We cannot afford the delay. Tens of thousands of seniors across Pennsylvania depend upon skilled nursing facilities for care. For many, it is their only option. Most certainly, the inclusion of PHCA's funding requests in the 24-25 state budget is an important and necessary advancement in the resolution of long-term care's financial crisis. I encourage my legislative colleagues to view these budgetary requests not as expenditures, but as investments in older adults who deserve access to professional care that is distinguished by dignity, respect, and compassion. With deep appreciation for the services provided by long care facilities to the Commonwealth, I will continue to do all that I can to ensure that this vital network is reliable, impactful, and accessible to those who need it. Thank you.
Thank you, Senator. I real quickly want to acknowledge Representative Kristen Marcel, who has been a co-sponsor, well, a champion and a co-sponsor of PHCA-supported legislation that would open the lines of communication between nursing home leaders and Department of Health, House Bill 1853. Thank you, Representative Marcel. Next, I spoke earlier about the nursing home in Pittsburgh that announced that it will be closing its doors. And we have Senator Jay Costa, the minority leader in the state Senate, who just happens to represent that nursing home that is closing. Senator Costa has been a staunch supporter and an advocate of long-term care. We've been very proud to work with him in his office, and I want to thank him for being here and for saying a few words. Senator Costa.
Thank you very much, Zach, and good afternoon, everyone, and thank all of you for being here. PHCA, thank you for the work that you're doing to raise elevating the issue of the crisis we find ourselves in with respect to how we care for our senior population. My hat's off to the folks behind me, the work that they do day in and day out, whether they're administrators, whether they're bedside folks, whatever your role might be. Thank you for what all you do to take care of our senior citizens in this Commonwealth. Thank you. We are very fortunate to have compassionate and caring individuals along those lines who participate in this endeavor. And we have to take steps here in the Capitol building to be able to change what we've been doing for the past several years. As I mentioned earlier, we are in a crisis mode right now, and we need to respond. And out of crisis comes opportunity, and we need to take advantage of this opportunity to be able to fix the system that we know it as we know it today. We cannot afford to continue to have these senior programs, these senior centers closed and out all around the area. In Allegheny County, I believe we've had 2. Scranton's had an additional evacuation. There's more coming. The headline in the Pittsburgh Post-Gazette the other day was 21 of these facilities were filing for bankruptcy. Certainly that's not a good sign for anything along those lines. We need to provide adequate funding. And let me be clear, folks, we have the resources. We have the resources in this Commonwealth, $14 million right now, and we're probably going to have $15 billion with an additional $850 to $1 million, additional $1 billion this upcoming month. So we have the resources to make the investments. And while their investments are also prioritization in how we want to take care of our seniors, and as many folks have talked about, how we judge ourselves as a nation, as a society, is how we take care of our youth and how we take care of our seniors. And quite frankly, ladies and gentlemen, my view is that we have been failing our senior populations, those men and women who deserve the dignity of the care and compassionate treatment that folks behind me and all folks across this country provide. We need to ensure that we have them, they need to have the adequate resources to be able to do that, and the adequate policies as well. And last but not least, as Zach knows, we were involved with the conversations regarding some of the providers and also the nursing home committee in the Commonwealth and SEIU and others. And we made a commitment a couple years ago, Zach, you remember that. We have an obligation to fulfill that commitment to make sure we provide the funding along those lines as it relates to the bedside hours and the like. So we have more work to do. I want to join my colleagues, Senator Judy Ward and so many other Democratic colleagues to ensure that we get this conversation over the finish line and get it to the governor's desk for the investments that it needs in his Commonwealth at this moment in time. Thanks, Zach. Thanks, everybody. You're welcome.
Thank you very much.
Thank you.
Thank you, Senator. I also want to acknowledge 2 more representatives, Representative Eric Nelson and Thomas Kutzer here. Welcome, guys. Thank you very much for being here and for your support. You know, I think it says a lot, no matter what's going on in the Capitol, no matter how busy things are, that our elected leaders are stopping over, they're stopping by, and they want to say thank you to the men and women behind me, to thank them for all their hard work. Next, I want to introduce you to Lauren Green, the Administrator and Executive Director for Inglis House. For those unfamiliar with Inglis House, it's a skilled nursing community located in the city of Philadelphia for people with complex physical disabilities. They serve 181 residents. As you're about to learn, this is not your typical nursing facility. Lauren has worked in long-term care for over 10 years, and she started her NHA career in 2017. She is a passionate advocate. Her mother has joined us today, and I'm glad you've joined us to hear her story. Lauren, thank you for being here.
Good afternoon, everyone. Thanks, Zach, for the introduction. Inglis is a nonprofit organization that has been in operation for 148 years. Inglis House is a skilled nursing facility operated by Inglis. Inglis's mission is to enable people with disabilities and those who care for them to achieve their goals and live life to the fullest. Inglis House is home to 181 residents with complex neuromuscular disabilities who all utilize wheelchairs for mobility. The average age of our Inglis House residents is in the early 50s. Our community differs from the traditional nursing home in that we are serving a younger population with different expectations, wants, and needs. We have a robust array of therapeutic and life enrichment activities. Residents can participate in up to 35+ activities weekly and 8 external trips monthly. We have an active resident council, a resident worker program, and a resident-ran convenience store and mailroom. Inglis supports an assistive technology department that keeps our residents connected and gives us the flexibility to create assistive solutions on the spot. To help you understand who we serve at Inglis House, let me tell you about Dave. Dave was a senior respiratory therapist at the University of Pennsylvania. He has a wife and 5 kids. In 2007, Dave was diagnosed with multiple sclerosis. Dave would continue to work for about another 5 years before going on disability. He continued to live at home for 9 years before his MS became too much for his family to manage. Dave and his family were first approved for in-home care 2 days a week, but that wasn't enough to manage his care. In 2019, Dave was admitted to Inglis House. Some of his first and most fond memories of Inglis House was experiencing King Games, our rendition of the Special Olympics. Dave explains the experience as remarkable, not your typical nursing home. The level of enthusiasm from the staff and participation from residents was unbelievable. Today, Dave remains a resident of Inglis House and is currently a resident worker in the facility library, the lead singer and member of the resident band Wheels, a peer member, and a previous secretary of the resident council. If Inglis no longer existed, where would Dave and the other 181 go to reside and receive care? The question of if not us, then who? It's a question that shouldn't have to be asked, but is becoming common for every facility across the state. Like other long-term care providers, we are still dealing with COVID burnout, workforce challenges, people leaving the field, stagnant wages, and lack of applicant flow. Unlike the standard long-term care facilities, 90% of my residents require 2-person assistance for all daily needs, and about 80% require some sort of feeding assistance. The number of staff needed to deliver our level of care is 2 times that of the standard long-term care facility. Looming federal staffing mandates mean that finding and employing qualified staff will only become more challenging. 93% of my residents are Medicaid. Reimbursement does not cover the array of services our residents need and deserve. When all care and services are factored in, there is a reimbursement gap upwards to $164 per patient per day. At this point, the rates due to change in July are unclear, but our experience has been that our rates have dropped 8% since January 2023. We at Inglis are hyper-focused on operational efficiency, but what we do is cut costs that impact the quality of services to those who call Inglis their home. We believe that choice is about options. If nursing homes are no longer an option because we are not investing in this level of care, are we really supporting choice? The majority of the 181 residents and their families who call Inglis home choose to be there every day. It is and will continue to be our mission to fight for nursing home rates to support resident choice, quality of care, and the dedicated staff we need to continue to deliver on our mission. Thank you, everyone.
Thank you, Lauren. Great job. Thank you, Senator Ward, Representative Coots. Thank you for being here. Thank you for your words. Look, it's pretty simple. We are 19 days away from the state budget deadline here in Harrisburg. This is my message to legislators. Make the men and women behind me on these steps a priority this year. Make our hardworking frontline staff a priority this year. Make our seniors a priority this year. Make our adults with disabilities a priority this year. Make their families a priority in Pennsylvania this year. Make long-term care a priority this year. Thank you very much.